So tonight, I'm speaking on a very simple topic. But before that, I would request all of you to please mark your responses to the poll questions. There are just 3 of them. How long do your ASAPS1 and 2 patients fast for oral clear fluids when posted for an elective surgery? 2 hours, 4 hours, 6 hours, or more than 6 hours? Okay. So the next one, do your patients receive intravenous fluids when they are nil per oral? The answers would be yes or no. Okay, so we have the next question. When do you restart oral clear fluids for your uncomplicated post-surgical patients? 2 hours, 4 hours, 6 hours, or more than 6 hours? Okay, so done. Most of them have, I think, attempted this. So we move ahead. Hope all of you have answered the questions. Now, let's go back a little into history and find out where this all started, the concept of fasting. Way back in 1883, Lister noted down that while it is desirable that there should be no solid matter in the stomach when chloroform is administered, it will be found very salutary to give a cup of tea or beef tea about 2 hours previously. However, in 1946, Mendelssohn, the one who documented the Mendelssohn syndrome, he found that vomiting during labor and obstetric anesthesia led to respiratory distress due to pulmonary aspiration of gastric hydrochloric acid. And there started NBM from midnight. Again, 1986, Maltby et al. Giving patients a drink of water up to 3 hours before surgery did not increase the gastric volume or acidity of gastric contents. The first death usually attributed to pulmonary aspiration following anesthesia was recorded in a young girl way back in 1848 and apparently occurred when brandy was poured in her mouth to resuscitate her at the end of chloroform anesthesia. In Mendelssohn's classic paper that introduced the concept of acid aspiration syndrome, he reviewed the notes of around 44,000 pregnancies in which 66 patients developed pneumonitis. But interestingly, even in an era lacking intensive care, none of them died from this. The only 2 deaths that were found were due to upper airway obstruction from solid food pieces.